There's barely a question in my mind as to whether or not I would be dead by now if I didn't have the internet to turn to all these years for validities, for validation of my feelings, support, encouragement, take your pick. Barely a question in my mind. I can't say for sure, but, and any of you who have never experienced that in your life, never been on the receiving end of abuse or having some, having your feelings, your legitimate, genuine feelings negated, etc., etc., you can't imagine what it's like. You can't imagine it. You just can't. My enemies accuse me of this, that, or whatever. I have my own problems, and I've admittedly not, on certain occasions treated my mom in the best way. But even as Auntie had put it to that lawyer, it's a mother-daughter thing, okay? And it's not easy living with my mother, okay? But I have been her staunch supporter. I have been there for her. I'm the one that got her. I left messages on my mom's cell phone that her primary care physician was willing to listen to. Remember, my mom's not able to communicate, succinctly communicate her feelings. Regarding that when she was on that 1,500 milligrams of Depakote and was having constant nosebleeds, like they were increasing in frequency, and her friggin' nurse practitioner, psychiatrist, in quotations, would just blow her off and be like, whatever. And even after, ignores my mom's legitimate concerns, and then even after, my mom's complaining of the nosebleeds, doesn't care, okay? Even after the primary care physician listened to my mom, listened to me, okay, about how the only reason my mom was put on 1,500 milligrams of Depakote by the assholes in that other hospital that my mom will never go back to again, over my Aunt and I's dead body, okay, which my mom would ever be sent to those assholes again. She was only put on the 1,500 milligrams of Depakote under false thing. She suffers a grand mal seizure of unknown origin 2 days after entering their facility, and they assume that means she's not on enough Depakote, okay? Unfucking believable, but whatever. The point is, I don't like my mother's nurse practitioner. She's ignorant, okay? My mom's primary care physician listened to my mom with my help. I was able to explain the real situation. He reduced the Depakote to a more reasonable 1,000 milligrams instead of 1,500 milligrams a day, okay? And my mom's nurse practitioner wasn't happy about it. Gave my mom a hard time. Fuck her. Gave my mom a hard time over it. Well, I'm really concerned, she's an ignorant twit. I'm not friends anymore, and I'm very hurt by the behavior of that church woman, okay? Which, of course, Auntie 100% agreed with me on, but then another quality of Auntie, she gets mad at me, she's going to turn around and just go against what she believed before. It's bullshit, okay? I did that for my mother, okay? I got her fucking Depakote reduced to a more reasonable. Auntie says, just because you're anti-psych medication doesn't mean you have to go out, flap the handle every time your mom. I don't flap the handle every time my mom's hospitalized. These have been specific things. The last time we were blindsided by the fact that she couldn't go back to that other place like we thought, okay? Because her Medicare, who knows why the government does that, only allots every individual on Medicare a certain amount of psychiatric stays in their fucking lifetime. Why is that? No one can tell me why. Just that it is, not why, okay? And then the other time I flew up the handle were those assholes down there putting my mother on 1,500 milligrams of Depakote, along with a million other psych meds, okay? And stupid NP, my mom's NP blew off my concerns then as well. to her, whatever, she just bows down to whatever these doctors put my mom on in the hospital. You get it? And then she continues that same regimen in the outside world. The Trazodone is a perfect example. We were caught up in that law, the court thing, and the elder abuse fucks, and this, that, whatever. My mom gets out of that fucking hospital, okay? And Auntie basically orders my mom, you know, puts fear in my mom. You need to comply with the medication, Samantha. You need to take everything that you were put on. Well, one of the things was 200 milligrams of Trazodone a night, as some of you know. It was way too much. My mother was in danger. She would sleep 10 hours at night, couldn't keep awake during the day. That put her in danger, me in danger, the dog's in danger. Because if you can't stay awake and you're going to be cooking or something and leave something on the stove, you can just fall asleep, you know what I mean? Did I ask the NP's little twits permission? No. I said, Mom, this is ridiculous. You should not be on this much Trazodone. We're reducing it. And then I called her after the fact and I told her. I'm like, you know, I said, this is how it is. My mom's not going to be on that 200 milligrams Trazodone. And what my mom had forgotten, because she does a bad memory, is that in that stupid hospital that had put her on so much Trazodone. Remember, a controlled environment. You're not fending for yourself. People are doing everything for you practically. It doesn't matter. They drug them up to high heavens in those hospitals, some of them. Okay? I didn't ask permission to lower the fucking Trazodone. And after the fact, my mom remembered. She's like, you know what? When they prescribed me that 200, they said it was only if I wanted to take it anyway. But remember, Auntie had said, make sure you comply with your medicine. Take everything you need to take. If my mom hadn't been living with my mom, you know, she would have just continued taking the fucking Trazodone like a good little girl. And she would have continued taking the 1,500 milligrams of Depakote like a good little girl. I know my mom has to be on medication. I don't have to be pro-medication to know that my mom has to be on the medication. And I don't have to bow down to every fucking thing these doctors think or believe. I told you about the NP2. My mom's complaining about being so dopey, and the woman's like, oh, you're drinking too much coffee. She's a twit. And when the church woman was our friend, she talked to me and really laid it on the line, because she's on my side on this medication thing. And she's like, you know what, Laura, your mom should really, because your mom has so many problems for so long, your mom should be seeing a real psychiatrist. And I said, yeah, but Auntie's the healthcare proxy, and Auntie would have to be involved in this, that, whatever, and I know that she won't. You know? And today I got my proof. Instead of just, the nice thing for her to have done would be to, like, I understand your concerns, Laura. When your mom gets out of this hospital, I will help you convince your mom, and we'll together try to find your mom a real psychiatrist. Just like Churchwoman was going to help me do. Remember, it was Churchwoman's idea that I 100% agreed with, but she brought it to my attention. You know? For a long time, I didn't even know this woman wasn't a psychiatrist. The fact is, there are certain people that aren't my mother, or aren't in and out of mental hospital, blah, 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 whatever, put on this, put on that, nothing working, blah, blah, blah. My mom needs a real psychiatrist. One that was willing to communicate with me, which is also not the case with my mother's little twit of a nurse practitioner, okay? The last time I called the woman expressing concern, letting her know that my mom had been forgetting for months, and I had only found out, periodically forgetting for months. I only found out accidentally when I happened to wonder why there were so many pills in the bottle that I was, you know, my mom sets up her own pills, but I was checked or something. I was like, why? I decided because I'm an investigator. And my mom had been forgetting to take her afternoon flufenazine. Okay, I'm not a nurse. I can't remember to tell her either, and I didn't even know it was happening. It had been happening for months. I don't hide anything, you know, from anybody anymore, from Auntie, from anybody, okay? I reported it to my mom's psychiatrist, the nurse practitioner, immediately, and asked her to please contact me. You think she bothered to contact me? No, she's a fucking bitch, you know? I do not like her. She suspected this last time that my mother was lithium toxic. There are patients that go off their medication. One night's not going to make a difference. She fucking suspected my mom was lithium toxic and is telling me that, but also saying, but I can't have her go off her lithium, Laura, even for the, you know. So my mom's lithium toxic and still had to take her friggin' pill, her 600 milligram pill that night that I had talked to my mom's nurse practitioner and the next morning before my mom went to go get the blood drawn and whatever. And then